Hi, I'm State Senator Justin Eichorn, and as we unveil some of our top priorities for this session, one thing that's still on everybody's mind and has been for several years is healthcare. The cost of healthcare and the access to healthcare. Unfortunately, that was an area where the federal government was supposed to act and lead, and like typical in Washington, they continue to fight. But in St. Paul, we still continue to work together. We made some reforms over the last couple of years, but there's more we need to do. Healthcare is still in a tough spot. As we were out talking to voters over the last summer, the one thing I heard was please do something in healthcare, but please don't let the government take it over. It seems like any area we've let the government take over, they seem to mess it up. So there are some reforms we need to look at. We've looked at price transparency things and access to rural hospitals for greater Minnesota folks, and we need to keep expanding on those and working together to find ways forward that aren't a single payer option. There are things we can do. Minnesota was once a leader in the country on healthcare, and I think we can be again. As long as Washington keeps fighting, I think it's time for Minnesota to lead again, and there's probably some areas we can do that in. And as all of our issues we're going to be facing this year, we'd love to have your input.